Homosexual men are at increased risk of diarrhea caused by which of the following protozoal pathogens? A. Blastocystis hominis. B. Cryptosporidium. C. Giardia lamblia. D. Isospora bailey. E. Microsporidia. Answer is C. Giardia lamblia. Homosexual men have increased probability of complicated protozoal diarrhea syndromes caused by Giardia lamblia and Entamoeba histolytica. Compared with the general population, diarrheal illnesses in organ transplant patients are more frequently caused by which of the following? A. Coronavirus. B. Cytomegalovirus. C. Herpes simplex virus. D. Norwalk virus. E. Rotavirus. Answer is B. Patients with organ transplants are at increased risk for complicated diarrhea caused by cytomegalovirus. Which of the following statements regarding constipation is correct? A. Chronic constipation is defined as the presence of symptoms for at least 2 weeks. B. Constipation is a disease is increasing in frequency. C. Constipation is more common in men than in women. D. Obstipation refers to severe constipation with constant pain. E. The incidence of constipation is lower in patients with a high body mass index. Answer is D. Obstipation refers to severe constipation with constant pain. Obstipation refers to constipation has become severe with constant pain. Obstipation represents the progression of symptoms toward bowel obstruction. Constipation is a symptom, not a disease. Chronic constipation is defined as the presence of symptoms for at least 3 months. Constipation is more common in women than in men, those with higher body mass index, and in elderly patients. A previously healthy, 50-year-old woman presents with a 1-day history of constipation associated with hard stools and increased straining. The physical examination, including rectal examination, is normal. Which of the following is the most appropriate next step in the evaluation and management of this patient? A. Laboratory evaluation of serum electrolytes. B. Obtain abdominal radiograph series. C. Obtain urinalysis. D. Order colonic transit studies. E. Prescribe a laxative agent. Answer. E. Prescribe a laxative agent. The majority of patients who present with a chief complaint of constipation do not need testing. Patients with acute constipation for which a cause is not readily apparent should be treated symptomatically and referred for outpatient evaluation and reassessment if needed. Which of the following medications is the most likely cause of constipation in a patient with an otherwise non-concerning history and physical examination? A. Acetaminophen. B. Albuterol. C. Famotidine. D. Hydrocodone. E. Naproxen. Answer is D. Hydrocodone. Opioids are the most common class of medications to cause constipation. The other medications listed do not commonly cause constipation as a side effect. A 25-year-old human immunodeficiency virus, HIV, positive man presents with a 3-day history of constipation. He also reports a perineal mass has been slowly increasing in size during the past 3 months and has become painful in the past week. He has no other complaints. Physical examination reveals perineal condyloma acuminata with one area of tenderness, friability, and erosion. There is no evidence of infection, and stool can be palpated in the rectal vault during digital examination. Which of the following oral agents would be most beneficial for the symptomatic improvement of constipation in this patient? A. Docusate sodium. B. Mineral oil. C. Psyllium. D. Senna. E. Sorbitol. Answer is B. Mineral oil. Oral mineral oil lubricants are particularly helpful in patients who have acute painful perineal lesions. The softening and coating of the stool can make passage much easier and less painful. Although not listed as an option, another consideration in this patient would be suppositories, which are especially helpful in patients who tend to have trouble expelling soft stool from the rectum. Glycerin suppositories may have a soothing effect and be helpful in patients with constipation caused by local, painful perianal lesions. Which of the following agents used in the treatment of constipation is contraindicated in patients who are at increased risk for aspiration? A. Magnesium citrate. B. Mineral oil. C. Polyethylene glycol. D. Psyllium. E. Senna. Answer is B. Mineral oil is contraindicated in patients with swallowing problems or patients particularly debilitated who are at increased risk for aspiration, because this could ultimately lead to lipid pneumonia if aspirated.